The number one sign you have a pinched nerve in your back is going to be tingling. It'll feel like pins and needles going down your leg. Hi guys, Dr. Dustin here at the Connect Chiropractic right here in Ames, Iowa. Today I want to break down the 5 signs that you have a pinched nerve in your back. Alright, so first, your lower back is made up of bones and vertebra. So there's 26 of them as they go down through the spine. The lower back is made up of 5 plus the tailbone. Now, between each of these bones is the disc, otherwise known as a pad. So this is the structure that helps resist all the force and helps cushion your day-to-day. Down in between the bones and in this canal lives the spinal cord. One of the most common ways that we're having a pinched nerve is going to be compression here on this pad. So this pad is made up of fibrous tissue on the outside, and then there's a gelatinous material right here on the inside. If that material gets pushed down for too long, that fibrous material will eventually start to crack, and you can start to get a disc bulge into the back of the spinal cord. But there are a couple other causes that are important to mention. If we haven't been taking care of the lower back, we will start to have some arthritic change and some bony formation on those joints. The next cause that we see is inflammation in the body. The inflammation will start to increase the heat and decrease the motion, making the joints inflamed and hurting. Therefore, everything is swelled up, giving less space for that nerve to function properly. The number one sign you have a pinched nerve in your back is going to be tingling. It'll feel like pins and needles going down your leg. This is different than muscle soreness. Maybe you've sat too long and it just feels like that leg is falling asleep and you got pins and needles. Sign number 2 that you have a pinched nerve in your back is going to be pain in the low back, but it also radiates down into the hip, down into the thigh, into the calf. Most severely, it'll come all the way down into the foot, maybe even to the big toe. Of course, that's the infamous sciatic nerve being pinched, being compressed, and there's going to be a lot of pain with that. Sign number 3 is going to be numbness. Numbness is different than tingling. Numbness is like you're touching parts of your leg or even your foot, and you just can't feel it normally. That's going to be a severe sign that we have a pinched nerve in our back where we're not getting proper nerve flow to that area. All right, number 4 is going to be a loss of motion. Because the nerves don't just control sensation, they also control your ability to lift your leg and lift your foot. Okay, so how this might show up is when you're walking, you might notice that one leg is harder to lift than the other. You also might notice what we see is people sitting and they just can't stand up because the weakness and because the motion is not functioning properly. The muscle is starting to get weak. And number 5, the biggest sign of all is weakness. How this is going to show up is you're just not able to walk the way that you normally could. You're going to notice that you're leaning to one side and you can't move both legs 100% properly, going up or down stairs. You'll start to feel very unstable. That's the weakness of the nerve, that you're having a pinched nerve in your back. And this is one of the biggest red flags. Here's a couple ways at home that you can test to see if this is where you're at. Are you able to walk on your toes? That's going to be a good sign if you can. Are you able to walk on your heels? You should be able to do both. You should have good coordination and you should have strength. Being able to walk upstairs strong, walk downstairs feeling stable, and of course be aware if this is something that you're dealing with, maybe a similar pattern going down one leg, starting to feel weak. The good news is not everybody that has a pinched nerve in their back needs surgery. We catch this soon enough, we get ourselves in to get some good imaging and a good consultation, a good exam to see what the cause of this irritation and this pinching on the nerve is. The sooner we get to it, the faster we can help. If this sounds like something you've been dealing with and you want to get it checked out, you can book a call with us or schedule at the Connect Chiropractic right here in Ames. If this video helped, please subscribe so you don't miss the next one.